For joining me. I'm Tammy Randolph with the Chamber of Commerce, and I'm glad that you've joined us for the Chamber Does What? My special guest is Lisa Lovelace. She is the CEO at Bradley Medical Center. Lisa, thank you so much for being here. I appreciate you taking the time to come.
It's my honor and pleasure to be here, Tammy. Thank you for asking.
I know there are a lot of things going on at the hospital. We've recently done a couple ribbon cuttings for you.
Yes.
And I couldn't wait for you to come and tell everybody everything that's going on at the hospital.
I might forget one or two things, but I'll do my best to remember. You know, for those of you who may not know, we bought the hospital, Vitruvian bought the hospital on August the 1st of 2024, and we've been so busy since that time. New stretchers and beds, looking at throughput in the ER. We've improved our patient satisfaction scores by more than 20 points.
That's phenomenal.
Also in the ER, we were ranked in the 25th percentile at the time of acquisition, and we've just passed the 50th percentile as far as quality measures and indicators are concerned. So those are huge wins for our community, and we're so excited about that. But as you said, in addition, we brought a lot of new physicians into the community. We've recruited 21 physicians since we've been here in
That's fabulous.
August. Yeah. And so among some of those new services that we had, or even some of the ones that were returning to the community, are ear, nose, and throat. We didn't have that service when we came here, and so we have a new physician who is providing that service. And then endocrinology also. We have beefed up and are continuing to work with Life Circle on OBGYN. We have brought Dr. Childs back to the community. I know, right? We're so excited to have him back. I mean, 85% of his practice was from Bradley County, so it's really great to have him back here and to be able to offer those services to the community. And we've expanded that service as well. We have 2 nurse practitioners and a physician in that practice as well. We have also recruited new primary care physicians into the market. We have a neurologist who is joining. We have also hired a neurologist that will allow us to keep more patients with inpatient neurologic disorders that will be here. So usually those go out of the community, but starting in the summer, we will have that service here in the community. We have a joint venture with Siskin Hospital, and we will have inpatient rehab beds, 29 of them at the West Side campus beginning in the fall.
That'll be great to have that one active like that again.
Yes, we're excited about that new face that we're going to have on the West Side campus. We already have behavioral health at that facility, and then again in the fall, we will have 10 additional beds in the emergency department that are already a part of our license. So we'll be expanding our emergency department as well. I'm sure I've forgotten something, but
there's a lot. Well, when you were talking about over on the West Side campus, they're in the professional building. That's where Dr. Childs is, and
yes,
that's also where the Women's Imaging Center is.
That's right.
So we did a ribbon cutting for that last year, but because that was quite a feat to have, because you got a special mammography machine over there, correct?
We did. You know, for the longest time, we have needed to upgrade our mammography in this community. So we have the tomosynthesis mammography machine that's over there now. So it's the latest and greatest in technology.
Say that word again.
Synthesis.
Thank you very much. I was trying to hear that.
So, yes, we have the latest and greatest in mammography over there, and we also have a DEXA machine over there, and it's on the first floor when you go into Bradley Women's Health Professionals, where Dr. Childs is located. So it's all just conveniently located right there in that area. We are also looking at expanding. We expanded orthopedics, so
yes,
we picked up Dr. Hutchison and Dr. Radford, who were here in private practice. They joined a practice with us, and we have since brought Dr. Calfee in, and we also have a fellowship-trained hand surgeon, Dr. Abby Halpern, that is also located in that practice. So
and it was bringing Dr. Calfee back home.
Yes, it was. So we're excited about that as well.
I think having a community hospital, that lets you see where it's needed in the community. And so what type of things are you seeing that you're still looking to close the gap with?
Well, neurology was one of them for sure. We're looking also at expanding behavioral health services, because those services are much needed in every community. It's a nationwide trend that we're seeing. So we're possibly looking at having outpatient services added to our current location, as well as expand, we're continuing to expand some of the services that we have. We brought additional cardiology services to the market as well with electrophysiology, which takes care of your heartbeat and rhythm, and then also having structural heart available in our market as well. So we're continuing to even add on to some of the subspecialty areas for the service lines that we have continued to develop.
Now, there's been some changes inside the hospital as well, physical changes that y'all have done, some upgrades. Can you tell a little bit about some of the changes that you've done?
So one of the things that we recognized immediately, Vitruvian as an organization really believes that, you know, there's pride in the way things look and in the way that we act, and we have culture changes and shifts that also speak to pride values, and it speaks a lot to the physical plant and the outside. So the outside of the building has been totally landscaped just to give it a fresh new feel. We have also painted inside, upgraded a lot of those rooms that needed to be upgraded. And then we've reopened the 5th floor that gives us extra beds inside the building to help with that ER emergency department turnover. And we continue to look at improving the way that each of the facilities look and the services in each of the departments. We'll continue to look at women's services and upgrading that area as well.
What has been one of the biggest challenges that you've had to deal with since being here?
Quite frankly, it has been community understanding of who we are. I knew, just because I'm from here, that was going to be one of the biggest challenges that we had. And we've worked very hard to help the patient understand and the community at large understand that we are here to put your needs first. It's been a bigger challenge than I really anticipated, just because there has been some, out of left field issues that have come up, like the United Healthcare plan, caused a little bit more concern around that. I'm happy to say that as of May 1, we are back in network with United Healthcare Medicare Advantage, and we are planning and having conversations about commercial as well. So I'm hoping that we'll have that resolved. But I think that added to some of the goodwill that we had built with the ER and the throughput times and that type of thing. We've added a patient experience director who does nothing but focus on the opportunities that we have with patients, and he goes to talk with patients about their complaints and concerns. And so we've tried to focus on that community patient experience. We get great results. We've also seen a 25-point increase in our patient experience survey results. So we're happy to continue to see that improving. That has been and continues to be the biggest challenge, because in this community, there have been so many name changes on that hospital.
Yes.
There were never ownership changes since the Bradley Memorial Hospital purchase initially. But Bradley Medical Center reflects our heritage and who we are. So as a community, I think it's important that we understand that we are a not-for-profit organization. That means that anything that we make, any money that we make, goes back into our community, and it goes back into the capital at the facility. It also will help to improve the pay scales, and it will help us to add additional employees and associates to our payroll. We've added over 200 positions since we acquired the facility.
That's fabulous.
Which has been it's been key in trying to make sure that the patients understand that they are our priority.
Well, I think having an employee shortage, that did not help with your ER times and everything, and being on the floor, because everybody's stretched too far and you can't get in there.
Oh, I think that's absolutely
wonderful.
True. Yes.
Are there different types of educational programs that come through the hospital for people?
I mean, when you speak to that, we partner with Lee University as far as their nursing program is concerned, and we have Jersey College that has a 2-year nursing program in there. We do a lot to partner with other not-for-profits and other industry in our community to help support that. Does that answer your question?
It does.
Yeah.
It does. You've always been great. You're a great partner as a chamber member with us, and we're very glad to have you as a chamber member. One of the programs that you partner with us very strongly with is our job shadowing with the high school students.
Yes.
Those kids take the applications, and they go all over in the different places. Can you tell a little bit about how you are involved with that and why you are a part of that program?
Well, as we look at our future, and when we look 10, 20 years down the road, that is our future. That's who's going to be taking care of us when we're needing to go to the hospital. And so we believe strongly as a culture that we need to invest in the future. We need to help them understand what they're looking at. Understand, even if they're not going into a healthcare field, they need to understand the healthcare process. It's a joy for us to have them there and to just see their expressions and to hear their feedback as they go through the different departments and they understand more and more about what goes on when you're in the hospital. I think that it gives back to the community in a futuristic kind of way. And then we have a lot of those students who want to ask more questions or learn more about a specific area of work. And so we love helping to make sure that everybody understands a little bit more about healthcare. And if they want to select that as an option for their career, then we want to help them do that as well. I believe in mentoring. It's one of the things that I love doing the most as a leader is mentoring and coaching, and that's where it starts.
That's wonderful. And they know they have a place they can stay home and they can be here and raise their family, and they have a place that they can go.
Yes.
So that's wonderful. And I mentioned you're a chamber member with us.
Yes.
What does that part, I mean, you're on our board of directors.
Yes.
Thank you very much.
I love to serve there.
What does that mean for the hospital to be a chamber member?
Well, one of the things that I am reminded of when we first came to the community as a not-for-profit under Vitruvian, we needed to do a community health needs assessment. And what that means is we bring several community leaders together. We send out invitations. We talk about the things that we need to do. And as a hospital, as a not-for-profit hospital, I should say, we're required to complete that community needs health assessment. And we did that in conjunction with the Chamber of Commerce, and we did it right there in your conference room there. And from that, there have been so many other opportunities to partner and make Cleveland healthier in conjunction with so many partners that we already have in the community. That's just one example of the way that the Chamber, I think, helps partner with communities in all of the areas, as well as with the healthcare needs assessment. I know that we've talked several times about what are we going to do next steps with that. We are always going to try to partner in that way, but that's a big global strategy that I think has been helpful. But in the everyday, I think it's been also helpful to be on the board and to have a close relationship with you all, just to get your perspective, because you're talking to industry all the time about their needs, and it gives us a vehicle or a bridge to help unify under what's best for Bradley County. And I think that is a great thing that you all strive to do all the time.
Well, thank you. You said several times that you are not-for-profit.
Yes.
What does that mean? What does that mean for the community? How do they can understand what a not-for-profit hospital is as opposed to a for-profit hospital?
So a for-profit hospital is usually, let me say this, a publicly traded for-profit. It's really three categories. A publicly traded for-profit hospital is someone or an entity that trades on the stock exchange. So they're focused for profit and returns on their investment for their stockholders. It drives a lot of what they do, and it drives strategy, and we all understand that. And there's a great place for those industries who want to function there. The for-profit but not publicly traded and the not-for-profit are a little different in that if it's a for-profit but not publicly traded, it's a difference between where your income goes or where the money that you make goes. As a not-for-profit, we don't have a holdings area for money. It goes back into capital. It goes back into reinvesting in making healthcare great in Bradley County. And so that's a requirement that we have, is to have the capital investments in the community so that we're continuously improving healthcare. And that's just something that's a little different from most other entities if they are not if they are in another sector other than the not-for-profit area.
Okay. I just wanted to clarify because some people don't understand exactly what that means, and
Yes.
I like to make sure of that. Well, I'm very glad that you are here and you explained what's going on with Bradley Medical Center. It is our community hospital.
It is.
And you are making the hospital and our community better. And
Thank
so I
you.
appreciate it.
Thank you so much. It's my pleasure to serve in that capacity.
Thank you. If you have any questions, reach out, call Bradley Medical Center. They've got some great people that answer the phones and take care of those things. Like, follow, share, and tell your friends. And I'll see you next time. Thank you. Bye-bye.